Hello, welcome everybody to Dentistry by Sweden live session number 3. Today we are proud to introduce to you our good friends from Estetikcenter, Amir and Mazi, and they will lecture for us in a short webinar about what they are doing and how they are doing their great stuff that we everyone can see and know that they are doing here in Sweden. If you don't know who they are, go and check and follow them on Instagram at Estetikcenter, and you will be blown away how incredible cases they are showing. And today we are honored to have them here, and I think we will just start directly. If you have any questions during the webinar, please write them in the comments, and we will take the time and answer them per email later. So you can write them, and then we will have an Instagram story next week. We from Dentistry by Sweden will answer your questions. So let's start. Welcome, guys.
Thank you. Just to clarify things, I'm Amir. This is Mazi. And we thought we'll clarify it, as it looks like we're two mirror images of each other now in the webcam. We can start off by saying that these pictures that you guys are seeing in our presentations, they were taken about, I think it's almost now 2 years ago. And as you can see, we've changed to the worse. We're getting older, and with the cosmetic dentistry is rough. So we'll give you a slide presentation of who we are, what we do. We've got a concept, our clinic today called Estetikcenter. It started in my hometown. The idea was to create a clinic where people could go if they wanted cosmetic dentistry combined with plastic surgery. But the plastic surgery part was left out, and we ended up with only the cosmetic dentistry part. I've always found cosmetic dentistry as being very interesting and a very challenging part of dentistry. And I've always felt that it's something that I wanted to provide to my patients. So it all started up from there, and then I met Mazia along the way, and we were on a course in Dubai actually together. It was after a very rough night in a club where we found each other and felt like this is where it's all gonna grow from now. So basically that's how we continued. I've been a dentist since 2009. I have my education in Umeå in Sweden, very great university, but I always felt like, we lack cosmetic dentistry in Sweden. We lack the education of it and to learn more about it. So
that's why we are happy that you want to talk a little bit about it today and educate us and show us how you work with cosmetic dentistry.
Thank you. I'll give a little bit of space to Mazi as well to explain.
I'm a quiet guy, so.
And I will just zoom out here so that you have the scene for yourself.
Thank you.
And I'm Mazi. I've been a dentist since 2010 from Gothenburg University. And most of the time now we are doing cosmetic dentistry, and it's really fun. And it's really fun to work with Amir as well. He's like my brother now. And we're happy to provide the good dentistry to Swedish people.
What we basically have done is that during our course, sort of say, or our development here, we've learned a lot. We've learned that you're never fully educated in dentistry. You can learn from anyone practically. We've done a lot of courses. We counted that all in all together, we've done about 80 extracurricular courses after our education, basically. And we've done it both on national and international level. We both believe that if you want to be a part of cosmetic dentistry on an international basis and develop yourself, you actually need to go to these international courses, and it's all over the world. You can go to Brazil, you can go to the States, you can go to Ukraine, to Romania, where all these great mentors are, such as Florin, such as Nazari. You can learn very, very good things from them. All in all, we'll give you a presentation of what we do. and we'll be more than happy to answer any questions you might have. So in our clinic today, this is our clinic in Gothenburg. It's me, Mazi, the owner or the previous owner of the clinic called Kent, our dental technician, Michael, our 2 nurses, and our dental hygienist. We work about 2 days a week each. So I work Thursdays, Wednesdays, Mazi works Mondays and Tuesdays. That's the days we work in Gothenburg. We also have a branch in Stockholm, and we were supposed to be in London as well, but due to the whole Corona situation right now, we postponed it. So we'll be in Stockholm, we'll be in London in hopefully from September. We were discussing this today. We never thought that Estetikcenter was going to be this big. We just wanted to do better dentistry and just deliver good work, and suddenly we feel it's grown pretty much. What we sort of want to say is, I guess we can show you this presentation, and it's something that we made for our clinic that we sometimes show our patients or in the waiting room, just to give an inspiration as to what we like to do. Hopefully there's sound on this, so we'll let you guys see it. So what this all started out was that we started doing cosmetic dentistry, each in both sides of the country basically, and we were discussing how we could improve our work all the time. As we went on international courses, we tried to implement what we learned in Sweden in dentistry here, and we realized one thing. The first thing you need if you're going to do cosmetic dentistry is a very good dental technician. You need a team. You have to have a technician that understands what you want to achieve. If you don't have that, you won't be able to do the end result that you're trying to imagine or trying to show your patients. Secondly, you can never promise a patient something that won't be realistic. You have to give them something that they can actually see, or get them on the line of what you can actually create that is realistic. Because sometimes patients can have unrealistic desires or needs for the new smile, and you won't be able to obtain that. So as we started developing our dental work, we realized that we wanted to make our veneers thinner and thinner and thinner. And usually nowadays, the minimal invasive veneers are about 0.3 millimeters in thickness. We thought of how we could get it even thinner. So once we actually purchased this clinic in Gothenburg, they had a technique of non-prep veneers. Using feldspatic material, the technician would actually create veneers as thin as 0.1 millimeters. Now this picture is actually one of our own veneers, where he got it as thin as 0.05 millimeters. And we just wanted to have it to show that it can actually become this thin. This can't be milled as far as I know today. It has to be handmade. We're a little bit skeptic towards having non-prep veneers in the beginning. So it was actually by chance that we started working with these more and more. And it was that one of my patients in one of the cities required one of these veneers. She said, I want one of the non-prep ones. You're not allowed to prep my teeth at all. So what we did is we created one of these veneers for her, and I tried it. And once I set it on the tooth, I added some water to it, and the veneer basically just disappeared and reshaped her tooth just as she wanted. And it was amazing. So what I did is I started taking loads of pictures of that. I sent it over to Mazi. I said, look at this work. It's absolutely amazing. We have to start doing more and more of this. And that's how it grew. And we've recently calculated that we're up and about almost 1,000 veneers this year. So it's going pretty fast. We've got a lot of demands for it, and we're pretty happy with it. As said, these are feldspatting. When we say non-prep, that's exactly what it means. We don't prep at all. We don't touch the tooth. We don't change the surface. We don't tell the patient we're just going to remove a little bit of substance here. If we do any kind of prep, we will tell our patients. They will know it. We'll never cheat anyone. So we'll tell them we're going to just remove a little bit of your enamel at that side, or we'll change the length of that tooth to make it look better in the end. But there's no need for us to remove any kind of tooth substance unless we're actually absolutely in need of it.
Excuse me, Amir, is there anyone cleaning in the room behind, or do you still have the drill going on?
Yes.
I think there is some background noise.
Yes, that is our cleaner. We'll tell him to stop. Just give a second. Sorry about that. I saw you were looking outside. You thought there was a leaf blower or something. But yeah. I think Mozzi's choked him up now.
Hopefully not.
No. Yeah, it sounds like it's good now.
Sorry for that.
Perfect.
All right.
I will make you disappear in the video as well, so we just can see and then show your slides.
Right. This case is our first non-prep case. This is the one where I felt the wow effect, that we had to continue this and we had to, develop it and make it better. We changed some of the things of how this case was made, or how these veneers were basically seated. We modified the techniques a bit, and when we handed these kind of images to our technician, he was able to modify his work as well. He could add more texture to them, he could add more colors, he could add more translucency towards the incisal edges, so we can actually develop each other by having better photos of our work. So tooth number 1-1 and 2-1, that means the two central incisors have non-prep veneers on this image. And this is, I believe, the side image of that same patient. The pros of doing this is we have no problems with gingival inflammations or any kind of irritations. The cleaning is very simple. There's no tooth substance removed, so if anything happens, the patient can always have the veneer removed. It means we have to drill it away, of course, and we'll probably touch their tooth at one point, but it's much better than not drilling it. The side effects of doing this is, of course, strength. You lose strength when working with these kind of veneers, and we always tell that to our patients, that they're not going to be as strong as a prepped tooth or a prepped veneer, but at the end of the day, if anything happens, we'll just drill it off and make you a new one. It's completely painless. The only thing they feel is when we try and clean the cements in the proximal areas using floss. Otherwise, they don't feel anything. We can produce this as fast as 24 hours for 10 veneers. But that's in express cases, basically. This is also one of the non-prep veneers. We took a photo from the side just to show how it's actually grasping the tooth, because the thing that we believe sometimes is different in the way our veneers are is that they're actually going around the tooth. They're actually covering it on the proximal areas and not just on the buccal area. This is a special photo that we just wanted to show how thin they are, how easy it is. All the other teeth that you can see in the image already have the veneer on. This patient had gaps that she wanted to have filled, so we just added these veneers on them. I think this was our second or third case. This is to show you how thin they actually are, or could be, how it looks when you just have it in before you've seated it. They can be either 0.4 millimeters thick to make a buccal size larger, sort of get a more symmetrical smile or a width. Or we can make them ultra thin just to change the shapes and not change any colors or anything. We'll be showing you a lot of cases. All the images that you will see are ours, except for this one that I'm showing you now. And the reason for that is that we thought we'll also tell you a little bit about how it is when we prep, because there are cases when we have to prep. So in our opinion, if you're gonna prep, you should have a motivational mock-up. For those of you that don't know what that is, a motivational mock-up is a design that you will show your patient before you actually touch their teeth at all. And the importance of that is because we need to know what our patients want. We need to figure out if we understand what they want, because once we start drilling the teeth or changing anything, we can never reverse that. So we need to find out if everything is correct in the beginning. So we always do a motivational mock-up first. We can do a motivational mock-up for non-preps as well, but it's just to figure out where our patients are at. We always use drill guides. So what you do is, once your patient accepts your motivational mock-up, then you do a functional mock-up. The difference is that the functional is a lot tighter on the teeth. For example, if you have a canine that is sticking out of the arch or coming out of the tooth arch and you want to prep that more, then the functional mock-up will actually not allow you to seat it if you're not prepping through that a bit. So the functional is used for your preps. We add the functional mock-up, and then we have drill guides just as this one. 0.3 millimeter drill guides that we go through the functional. Wherever it touches the tooth, you will have to prep that tooth. We use 5 times enlargements in loop. This is not for commercial purpose at all, but we purchased our loops from Bryant Dental in London, and I can definitely recommend them. They got perfect lighting, you've got cover for UV covers for your light, there's battery driven light, so there's no cords, and the 5 times zoom, it actually shows you everything. So it's perfect for finding your prep margins or keeping it minimal invasive. So that's definitely to recommend. If you want to step up cosmetic dentistry game, then you should visit Maximo Belograd, Nazari, or Florin, and you go to their courses. That's the ones that are closest to us in Sweden. There's great dentists all over the world, but these are the ones that we have visited at least, and would recommend others as well. This is a bit just to show, you know, that we do preps as well. We try and keep it as minimal as we can. Usually when we prep, we try to be on the enamel. That means that most of the times, or sometimes, we can do preps without actually having to numb our patients. That doesn't mean we always do that, but there are times that we can. This is one of our own cases. It's 2 veneers that were prepped. The lateral incisors are prepped a little bit more in the approximal area because she had a filling and a little cavity, and I wanted to remove that so the veneer would actually sit only on the tooth. And the central one was already shorter. The reason this patient wanted veneers was because she had damaged these 2 teeth, so they were shorter than the other ones. So when she smiled, she didn't show much of them, so she wanted it to be longer. These are 2 Emax high translucent veneers. I think the shade is A1. That's the final result. We always criticize our work. So if I show this to a lot of people, they might think it looks great, it's perfect, or others, but I would say it needs more shine. It doesn't have maybe enough glaze, or it's not shining enough. So we criticize all our work, and I criticize Mazi's work, he will criticize mine. And it's the only way we develop ourselves. I would never get offended if Mazi told me that's a bad work, or it looks bad, or it's that. It's what we need to develop ourselves to be able to improve our work. So we always take end photos and before photos, and we can show that to our technicians. We can say what we want them to improve and make it better. You could probably trick people by adding some water to these 2 teeth, and then it will look like they're shining more. But in this case, we prefer to just show it as the reality it is. Simon, if you ever want to interrupt our questions, just tell us, okay?
Sure.
Same goes for you, Mazi. If you feel I'm talking too much, just tell me. When it comes to our non-preps, we use regular silicone impressions, heavy and light body, nothing other than that. just use heavy and light body. If we need to check the bite in the corresponding jaw or the antagonist, then we just take a regular, I think it's called alginate powder, basically, impression. And we usually just take an index so our technician can see what we want and how to adjust everything. Cementing is pretty easy. You guys probably already know about this, but we only use Variolink Aesthetic LC, no other cement. That's the only ones we use. And according to what they say, basically monobond, and as a bonding, we use OptiBond FL.
One question, Amir, to the impression taking. I think a lot of people will ask, aren't you taking digital impressions as well? Because we know you have
for non-prep
digital as well for your smile designs. But why aren't you using digital impressions for the veneers?
For non-preps, we don't do that. And it's because our technician can only create them on regular impressions. So he can't make the non-preps on digital impressions. That's why.
I think most of the
everything
they will agree with you that they usually recommend to take don't take digital impressions when you're making thin veneers.
Yeah, could be a distortion in the scan. It could be something else. We've actually never tried it, as far as I know, but we have only done it with regular impressions. Other than this, all our work is digital. We've got 2 Trio scanners. We cannot say how the other scanners are, but we love Trios. It's working perfectly fine for us. We've got 2 3D printers, and we've got a full service lab. So we'll get a little bit back to that as well. But yeah, when it comes to the non-preps, it's just regular impressions. And that's because we hand it over to our technician and he does the rest of the work.
Thank you.
You're welcome. This is what we use. This is what I would recommend everyone. If you're doing veneers, this is the best way to work. We've got a little tip for our blue phase curing light. The tip is basically a tack and cure, where you basically cure a center of your veneer and it will be seated, and then you can clean off the proximal areas and the rest. It's really easy for everyone that has cured veneers, either 2-second cures or people that go for 20 seconds and try to remove the excess. You'll know that it's pretty difficult and it's pretty rough. Both of us only use scalpels to remove excess cement. So all our excess cement, we go through the proximal areas, the gingival areas with scalpels, and it's really good. Once you get used to it, you have to be careful. I've heard about people doing this and there's actually accidents, but you have to be careful and control your movements. But once you learn it, you'll realize it's one of the best equipments ever. It's better than your other instruments, basically, because all the other instruments, as far as I'm concerned, there is a risk of damaging the veneers, but with the scalpel I've never been able to damage anything. And also that it can actually get into the thinnest areas and proximal areas. And if you got 5 times zoom on your loops as well, you're going to see everything, all the mistakes and everything that you need, basically. And then we go through the proximal areas with saw strips, and these strips then have small slight holes in them just to get off the excess cements where we can't reach it with the scalpel either.
You can buy them from Dental Mind, I think.
Yeah. So this is, I guess, a little flick through a couple of cases we've done. I believe that these non-preps are great for when we have these kind of patients. This patient came to me, she was very scared. She was very worried. She had dental anxiety. She didn't want to prep her teeth at all. She would cry just being in the waiting room. So she was a perfect case for me to cover up with non-preps, because it was pretty easy to achieve the results she wanted. Since we didn't get to prep at all, I couldn't get them as thin as I wanted, but at the end of the day, she was happy with the final results, and she had the correct length on her teeth, and we managed to fill out the gaps as well. As time has passed, we've pushed the limits of these veneers and pushed our technician as well as to see what we can actually achieve. So this is a case we did, I think it's been over a year now. I've seen her on her 1-year recall as well. Looks pretty nice. She's a patient that has a great personality, lovely lady, loves to sing, but wasn't happy with her smile. She felt embarrassed when she smiles. We got some pictures, just to say beforehand. We got some pictures of our patients. There's some pictures of their faces as well, but please don't like share all those pictures, even though it's on YouTube later on, but don't post it out there more than that, please. This is a case that we did with only non-preps. We changed the colors, we filled the gaps, and we haven't prepped anything on her. That's the final result. Colors of our patients' teeth are usually chosen by themselves. If we feel they're a little bit too off or won't suit them, we will tell them and try to tone down their wishes. But other than that, we try and follow what they want. This is one of the cases that you saw in the video. It was a girl that wanted to have veneers, to have straighter teeth, more symmetrical teeth. She had small gaps in between, but she was unhappy in general with her smile. Wanted to give her a natural look that would enhance the way her teeth looked, but at the end of the day, still be a smile that she can actually get off with by just smiling. That's the final result on her. This is directly after seating. So after that, we didn't get to see her anymore because she doesn't live here in Sweden. This patient was, I think, the first case where we pushed our veneers to its limit. She came to us. She was on a waiting list for orthodontic treatment, but the waiting list was about 2.5 years. She was missing some teeth. And when she came to me and I saw this, I told her, I said, I have no idea if we're going to be able to help you with this, but let's do a mock-up and see what it will look like. And if the mock-up looks good, then we'll take it from there. So we did the mock-up. She was happy with it. It looks very nice. And I told her that since the mock-up worked, then we'll use Invisalign to readjust how her teeth are set. So we'll get a little better leveling and a little better distances between the teeth, and also due to her bite. Her lower jaw, when she was biting together, it wouldn't allow us to make the veneers. So we did these changes, and after that, we did the non-preps on her. I think we did about 10 non-preps on her. This shows how she's biting together. So her bite was colliding with the veneers in the front when we did the mock-up. So we realized that we wouldn't be able to do this. This is not a complete non-prep because, as you can see, her canine on the left side, her 2-3 or upper left canine, is sticking out a bit, and even after orthodontic treatment, it was still sticking out a bit. So we did reshape that a little bit, but it was still done without any kind of numbing or anything. So it was very little shaving of the teeth. That's the side views. This is the day she came and tried her mock-up. So she was happy with the result of the mock-up, and I told her that that's when we'll try the Invisalign, we'll go further from there. This is after her orthodontic treatment or after her Invisalign. So we decided that we'll take off a little bit of the incisal edge of her upper left canine and also a little bit on the buccal area of it, so we could add the veneers and make it look nicer. We also did a little bit of gingival corrections just to get better symmetry and length on her teeth. We also took away the frenula in the middle, because that was probably one of the reasons as well that she had that gap. And that's the final result. We did get a slight gap afterwards. I think it was because she missed that she had to wear the retainers even after this. So they did move a slight, but we set in some retainers and moved it back. But I've seen her on I think her 1-year recall just recently, and looks fine. Everything is still okay. And she looks great. She's happy. She's loving it. And that's the final result. These changes, like the patient before this, these are changes that we feel are life-changing. We don't see this as creating a change that is just, to make it look nicer for us or something like that. I mean, this changes this girl's daily life. She can smile, she can be happy, she can be self-confident, and it actually, whether we believe it or not, it adds a lot to how their life will continue. That's what we believe, at least. But from what we see when we see our patients on their recalls, we can see changes in their behaviors. This is just to show you that we don't do only non-preps in porcelain. We have patients requesting it in other kind of materials. So we did a non-prep in gold here. It worked out pretty fine. It was very difficult to cement this because I had no idea how to do it properly, and it kept falling off. It took me about 4 times until it actually was seated properly. And I was scared because the patient, basically, a patient that wants a gold tooth is not a patient where you want the veneer to fall off. So,
which cement did you use in the end? You remember that?
I used Rely X, actually. I couldn't use Variolink on that one because it's light curing. So I used Rely X, but it still wouldn't cure through it. So what I did was, the final time I actually seated it, I cured it quite a lot, let's just say that. And then I just left it like that for 3 minutes as well. And then it was stuck, and I haven't heard from him yet. And I think it's been 8 months now. So hopefully it's still there. This patient came to us with a request to close the gaps, make it more symmetrical, but she was very strict that I wasn't allowed to touch her teeth at all, like no drilling, because otherwise I would have maybe taken away some sharp edges, some incisal roughness, but she didn't want me to touch it at all. So, as according to her request, I told her that there will be some compromises if we're not going to touch your teeth at all, because when you work with non-preps, you have to look at the dental arch, or the teeth, how the teeth are standing. And the tooth that is most buccal will be the reference point for everything. So we looked at it, she accepted it, she came back, she got her veneers, it looked like this. The thing with non-preps are that it's about 50-50. 50% of the patients love it, 50% feel it's not me, maybe it's big, maybe it's long, and it's because their brain isn't used to watching themselves like that. It takes about 2 weeks. So when they give us that reaction, we actually tell them, give this 2 weeks and it's gonna calm down. And we've never had to remove anything yet. So that's so far pretty good. Same thing here. It was a businessman. He did not have a lot of time. He wanted us to be able to clear this pretty fast. He wanted a symmetrical smile and nicer color to her teeth, but still natural looking colors. So we gave him a little push in getting a nicer smile and getting it better, basically. This patient had these stains on her teeth. She wanted a wider smile and a nicer one. She felt like when she was laughing, she wasn't feeling secure enough. This was actually a test, and so far it's been working. She's been past a year now, but it's worked so far. What I did is, on her 2 centrals, we added icon. The regular just icons that remove stain. We added that just before seating the veneers. So I tried the veneers, she accepted the shape and everything. Then I did icon treatment, removed these stains, and then I seated the veneers on top of that. And it's because the 2 central veneers are very thin on her. So if I didn't do that, it would actually let through the brownness of her teeth, and you could see stains in her veneers. I told her, I said, this is the first time I'm doing icon and then seating veneers on top of it. So we have no idea how it will look. Maybe in 1 or 2 years' time, it will have returned. And if it does, then we'll remove those veneers and create new ones and change it. If it doesn't, then that's fine. This is, I think, about 1 or 2 weeks after cementing. And it still looks the same. She's happy with the results as well. And And as long as she's happy, we're happy. This is a follow-up we did, because we often get these questions: how long do veneers last? How will it look? What will happen? How will it look in the future? And we don't try and push our patients to buy treatments. We just tell them the reality. I personally believe that I can't tell any of my patients that if I do veneers for you, it's going to last for 20 years, or it's going to last for 15 years, or 10 years for that matter. I tell them you have a warranty for 2 years. Then it will last as long as it is actually possible. We have the longest follow-up we've seen on non-preps. Of course, it's not my case. It was Kent, the previous owner of this clinic, but it's 25 years. 25 years without fracture or anything. This is just, I mean, a great case. It doesn't mean all these cases will last for 25 years. So that's why we tell our patients, very individual. No one knows what you're going to do with your teeth, how you're going to take care of it, what you're going to do at all. So if it works fine. This is 14 years follow-up on her lateral incisors. They both have non-prep veneers on. They're still there. She's happy and it looks good. I believe, you know, if you've got non-preps that are lasting 14 years, then it's done its work. You know, it's been worth it. This is a more extreme case that we had. This patient came in. She had been to 2 specialist clinics, one orthodontic, where they told her that, you know, there's no chance we can fix your teeth. You're pushing them out with your tongue, and also your 2 front teeth are not good enough. You need to go to perio. She went to perio. Perio told her we'll need to maybe extract 4 teeth and we'll create a bridge for you. So she came to me and said if there's any other way to do this. And I just told her, you know, you can do Invisalign. We'll try it and see what happens. And after you're done with your Invisalign, we can do non-preps. And she decided to give it a chance, because I told her if it doesn't work out, you can still extract your teeth. Extraction is always an end option. She ended up like this after Invisalign. Her teeth are still stable. There's no increased mobility in that sense. I did a little bit of prepping on the buccal side of her 2 centrals, as you can see, and it was to, you know, push them in a little bit more, because the Invisalign wouldn't actually take them in anything else. This is what this patient looks like today. She has a retainer, and she also has an S6 retainer as well. They're still in place. They've been like that for about 7 months now. She's not pushing it out with her tongue. She's very happy, and as long as we don't need to extract her teeth, I'm pretty happy as well. This is how a non-prep looks before seating. This is how thin they are once you add water to them. So they're basically see-through, a lot of it. I think that's most of our cases, what we've said so far. I don't know, Sam, do you have any questions?
You're talking there about the follow-up, and that's good, because I think many people, like you said, will ask how long will they last. And of course, I think you are used to get some, like in Swedish dentistry, a lot of people are a little bit criticizing cosmetic dentistry, and they're saying they are hurting teeth or they're just earning money. But the good thing, and I think that's the interesting and amazing part with your work, when you're working with non-prep veneers, like you said, the worst thing that could happen is that you need to redo it one more time.
Yeah.
And that you aren't damaging any tooth substance and so on. So I think that's a great option to show the patients. But yeah, of course, I know you have a great technician. You have a lot of experience in it. What would you say? Would you recommend to try non-prep veneers to anyone else, or do you think we first need to come to your clinic, work there, or go behind your look over your shoulders and see how you're doing it? Or do you think that is anything for some like normal dentists to do?
Yeah, I would say this. Yeah, like the first time I met non-preps was at a course, and this dentist was working purely with non-preps, a dentist from the States. it was amazing the work he did, and I was very impressed. And as with everything, you know, every course you go to, you're suddenly overwhelmed with what they're doing, and you come back to your clinic and you want to do exactly the same things. Suddenly it was all non-preps, but then I didn't find a technician that would deliver the non-preps, and it was impossible. So we couldn't do it. Today, you know, it actually, I think it goes for both of us. You know, you're always a little bit nervous. You know, being nervous keeps you on the edge. It makes you do your work properly, and always, because I believe the day you're too confident and you're super confident with everything you're doing, you're going to make more mistakes. You always need to be on your toes and know what you like. You treat every patient as a new case, as a new thing, but showing them that you know what you're doing. So when it comes to non-preps, it's the handling part that's difficult. You know, they're very thin. If you hold it between your two fingers, you're going to break it. If the patient smiles a little bit too much and touches it with their lips and it drops to the floor, it shatters. An Emax veneer, as most people know, it won't. If you drop it, it drops. You just pick it up, clean it. But these are not forgiving. I haven't had it yet, but I've heard there are, like, not with us maybe, but there are times when people use non-preps and they cure the veneer, and at the same time they crack it. So you've got a non-prep on a patient that you've just cracked, and hopefully either you don't tell them or you just let them be until coffee stains that crack, or you tell them and you say, all right, look, I promised you a non-prep veneer, but I have to remove it, and I remove it with a drill. And I know you don't like drills. You know, the story will continue like that, but it is sensitive. It's not superhuman work. Anyone could probably see that. You just need, with everything, you need experience. Yeah. You know, I believe it's the same thing. Prepping veneers, everyone, I tell my patients that, you know, everyone can actually just put their foot on that pedal and just put that drill to your tooth. But it's knowing how to move that drill, how much of your tooth substance to actually remove actually is necessary to remove or needed, or so that will make the difference. And I agree with you, Simon. In Sweden, we frown upon cosmetic dentistry because it's dirty, it's bad, and those people just want money, and it's not good. And why should? But at the end of the day, that's my personal opinion. Why shouldn't cosmetic dentistry be a part in everything we do in dentistry? Why should we not deliver the best color, the best shape? Because that's what cosmetic dentistry is to us.
That's true.
Not trick our patients that this is the best thing that can be done. No, it can always be done better. Even our work, it could probably be done better some other part of the world. But we need to tell our patients that then. You know, it can be done better, but you're going to probably have to pay about 4 times as much then. We're going to have to send this to a technician that is maybe in that part of Brazil, and it's going to cost you about 3 times more. But that's the reality. We've had cases where patients were referred to specialist clinics. There are great specialists out there. We're not like talking bad about anyone, but you know, when you see these cases, you will question, how can this patient be given these teeth and be allowed to look like this and go away and smile, and someone be happy about that treatment? You know, because a lot of the times it's young people, and if you're young and you have an accident and you can't smile after your treatment is finished, then what have we obtained? So for me, that's where cosmetic dentistry comes in. It's not just creating something on perfect teeth. It's creating the best you can every single time, and actually criticizing your own work as well.
Another thing I was thinking about is the oral hygiene. Of course, when it's not, there must be any. Now you said that they are really thin, but do you have any extra hygiene routines you give your patients to clean those veneers that are non-prep?
Yeah, what we do, we clean their teeth, the surfaces of their teeth, pretty properly in 3 or 4 steps. So we keep the surface very clean once we seat them. Once they're seated, we tell them all they have to floss daily. It's only regular floss that we recommend them, or the thin ones. using their toothbrush, brushing twice a day. Preferably, we're not sponsored in any kind of way, but we think Oral-B's electric toothbrush are the best. So we tell them, you know, use these because it's better for you. If you've invested so much money in your teeth, just add a little bit more and you'll keep it that way as well. And fluoride rinse. There's nothing else.
Sounds good. And what we could see at your cases, I think, like in all prosthetic treatments, it's important that there are healthy conditions before you do anything.
Yeah.
The last thing I thought we could talk about is, of course, you're working a lot and sharing a lot of cases on Instagram, on like social media, and I guess you get a lot of new patients from Instagram as well. Just do you have any tricks or anything you could tell our listeners? What do you think is important when you're working with Instagram and social media?
Instagram, I would say, Instagram, I was very skeptic to that. It started, I think, 4 or 5 years ago or something like that. And it was actually, well, it was actually my, I would say by now then, my ex-wife that actually told me, you should create an Instagram. And, you know, when she said it, I looked at her and I was laughing. I was like, no, that's nothing for dentistry. You know, we don't do that. Said, yes, there are dentists in the States. They have Instagram. It's great. I looked at her again. I was like, no. You know, after 4 or 5 times, everyone that's been married, they know you're going to lose that battle. So I looked at her. I said, you know what? You do on Instagram and you can have fun with that. And she did. And she kept telling me, give me cases. I'm going to post them. And that's what we did. Today, I'm very happy we did an Instagram. It's our first and foremost marketing area. It's not just for the marketing. It's not just getting our patients in, but it's, you know, we can tell our patients whenever they say, do you have any cases? Do you have any before after pictures? We just show them our Instagram. It's a huge portfolio of what we're actually able to achieve. It's high quality photos. If you're going to work, I wouldn't say only cosmetic, but if you're going to work with proper dentistry, you need a good camera, good objective. These things cost a lot of times, but you could probably get them at better prices in the beginning. You need either dual flashlights or studio lights. You need to be able to show off your work for yourself so you can criticize your work, but for your patients as well, because it's very important. So Instagram does give us patients today. It does give the patients an opportunity to compare work. They can compare our work to other dentists. And if they like another dentist's work, they're more than welcome to go to them. You know, it's fine for us as well. We are very humbled about how you presented us. We don't believe that we are magicians in any kind of way. We just try and deliver the best we can, try to be the best we can in what we do. And we always feel that we can learn more and develop more.
Do you have any plans in the future? Because I know the literature, when you're like looking for evidence for non-prep veneers, it's difficult to tell. Oh, is it non-prep? Is it a little prep? And you have a lot of, you have quite long follow-ups at your clinic. Do you have any plans to maybe start a study or anything to in the future?
We've discussed it. Yeah, we've discussed it. Currently, I would say that our clinic and our work, it's growing very fast. I mean, Estetikcenter in Gothenburg for now has been here for 2 years, and we're very happy with the growth we're having, but it's been so fast. So, I mean, we're already in Stockholm. I would say now, I'm saying that we're working 2 days a week, but to be honest, we're more or less working 7 days a week because we have a lab. We do all our work, all our prosthetic work ourselves. We're both dentists. We have no idea how to work with dental technician stuff. So we've learned a lot of it, and we've hired technicians to work with us. When we're not working clinically, we're working in our lab. We're learning new things.
The point is you don't have really the time for it. But maybe it would be interesting for someone out there who is interested in making a study to come to your clinic and see what you're doing.
Yeah. We've had students coming here and having interviews or asking us, and we're more than happy to answer questions.
Amazing.
But just as you say, we're growing too much and we don't have the time right now.
Thank you very much for taking your time. And like we said before, if you have any questions, be free to. The best thing would be to, because like you said, you are so busy, you two guys. So you can mail to dentistrybysweden@gmail.com if you have any questions to Amir and Mazi, and we will send them over and we will be more than happy to answer your questions. And for you two guys, good luck. I think we'll see each other soon again.
Thank you.
And I think the next time will be probably a Dentistry by Sweden event number 2 in winter this year.
Looking forward to it.
Thank you very much and have a good one.
Bye-bye.
Bye-bye.
Bye.